Miss Snowgrove. I'm Lori Haley. I'm going to be your nurse today, and I'm here to take your vital signs. So, can you tell me your name? I know I just asked you, but can you tell me your name?
It's Susie.
Okay, and can you tell me your birthday?
9/30/75.
All right, and I need to check your arm in, just to be sure. So, how are you today?
I'm okay.
Have you had anything to eat or drink in the last 30 minutes?
No.
Okay, good. Have you been up and about, or have you pretty much just been in the bed?
I've just been resting.
And you just came into the hospital, so I also need to take your blood pressure. Has it been a while, probably since you've had a blood pressure taken?
I don't even remember when I had it taken.
Okay, all right, thanks. Well, let's do this. I just want you to raise your tongue up. Put that in there, close your mouth, and I'm gonna hang on to it. Just take just a few seconds. Okay, 98.0, that's good. Take your pulse. Just let you rest your arm here if you don't mind. Your pulse is 72 and your respirations are 14. Just for learning purposes, what I did is I took the radial pulse for 30 seconds and multiplied times 2 because it was regular. And she didn't know it, but I was counting her respirations that other 30 seconds and multiplied times 2. Because if you tell a patient that you're going to count the respirations, what would happen? You would probably change your breathing up. Now, if by any chance it's irregular, her pulse and or her respirations, you need to count whichever one's irregular for a full minute. So I'm going to listen to your apical pulse. That's actually listening to your heart. So, and when I do that, I need to listen for a full minute. For learning purposes, I'm going to show you how to landmark. You're going to find the patient's suprasternal notch, and you're going to go down to the angle of Lewis. And in the return, you can just do the rest of this on top of the clothing. So I would find the second intercostal space, then I would go down to the third, the fourth, and then the fifth intercostal space. And where I find the apical pulse, or also what we call the PMI, it would be at the fifth intercostal space at the left, and it'll be left mid-clavicular. And so for your return, what you do is just make sure you use your stethoscope properly. You want the earpieces to be towards your nose, and you're going to listen with the diaphragm portion. So once I put this in my ears, you're going to see me tap real gently to be sure that I'm on the diaphragm side. If not, I'll just need to turn this, tap again to be sure that I have that. When you hold the stethoscope, you don't want to be touching on top of the bell. So you take your fingers and you hold it on each side of this when you listen. And then all you'll do is I'm just going to slide up underneath the patient's shirt to keep their modesty and their privacy at that time. And I'll listen again for a full minute. Just going to listen. It's also 72, which is what you hope to have, is the radial pulse and the apical pulse should be the same. Now, since it's been a while since she's had her blood pressure taken, I need to estimate her systolic. So I'm gonna have to palpate for that first. I wanna take the cuff and be sure it's the right size. So you'll hold your arm up. The cuff should be at least 40% the circumference of the arm. And when I put the cuff on, I wanna find her brachial artery. Good and strong. And I wanna put this on so that this is directly over the artery, and it should be 1 inch above the antecubital fossa. And I should have it on firmly enough that I can slide about 2 fingers underneath there. And I just want you to rest your arm. And the first thing that I'm gonna do is find your radial pulse, and I'm gonna pump the cuff up until I obliterate that pulse. And that'll be her systolic. Just pump and feel. And still feel the pulse. And it went around 120, so I'm just gonna let off real slowly. Make sure, 118 actually. And I go all the way back down to 0 so I can let her arm rest. And I need to wait 1 minute before I take her blood pressure because I could falsely elevate it. And so just to take a minute, and we're gonna speed up time just a little bit. And 1 minute has gone by. As I let the manometer fall, I want it to fall about 2 to 3 millimeters of mercury per second. So I'm gonna pump up the cuff. Since it was about 120, let's say, I'm gonna pump up the cuff 30 millimeters of mercury above that. So of course that'd make it 150. Properly put your stethoscope on. It's been a minute. Again, find her brachial artery. (118/68). It's really good.
Yay.
Last but not least, let me raise your arm for just a second. I want to check your pulse ox. Pulse ox on your finger. And see what your oxygen saturation is. It's 99%. That's very good. You got your call out and reach. You got your side rails up. Your bed's in low position. Do you need anything?
No, when can I go home?
I don't know. It may be just a little while. Thank you. Any questions
No.
besides that?
No questions.
No. Just a little added piece about when you're doing the apical pulse, when you're listening to the heart for that full minute. This is a big cause of concern a lot of times with your female patients. And in the hospital, generally they just have a hospital gown on and no bra. So what you would actually have to do is you would have to just ask the patient, or you would need to lift the breast up, and so that you can get to the 5th intercostal space at the left midclavicular line. And it's basically, if everything was anatomically straight, it'd be, below the nipple line. So when you do that, just be sure, rather than cuff the breast like this, cup it like this, you don't want to do that. You want to use the back of your hand. So you just gently lift it up, and that way you can put your stethoscope. And pretty much the site yours where the breast tissue ends and the abdomen begins.